Good afternoon, everyone, and welcome to IAP2's Learning Webinar. On behalf of IAP2 USA and IAP2 Canada, we would like to sincerely welcome you to our monthly learning webinar today on creativity and innovation and the greater good. It's just such a real pleasure to welcome everyone. We're getting some great feedback on our webinars, and it's thanks to you and of course our wonderful presenters. So it's a real pleasure to welcome everyone here today for the webinar. So we're going to get going really quickly, but before we do, I'm going to invite Drew to just give a little bit of housekeeping and let people know what they can expect. Drew, over to you, please.
Well, we have, this is always very interactive, so we're going to be recording this so you can review it later on. We'll have the various collateral such as PowerPoint presentations, any links that they've got, and of course these people are Core Values Award winners, so they produced some videos which were very informative at the Core Values Awards at the ceremony last year in Montreal, and we think you'll find them informative as well. If you haven't already had a chance to look at them, we'll put those up on your respective affiliate websites once this is over with, along with a recording to this too. We also have a survey that we'll be asking you to fill out. We'll send that around to you. As Amelia said, we're getting great feedback on the webinars, but you could always do things better, and we'd like to hear back from you as to what you would like to see, maybe some ideas for future webinars. All that's going to be in there. We have your microphones. They are all set on mute at our end. If you have muted your microphones, please take them off mute, because if you want to ask a question or make a comment or something verbally as opposed to typing it in the question box, we'll unmute you from this end, and you'll be able to say it. On that, there are a number of ways you can ask questions, and you probably see the little picture there on the screen there on how to ask questions. You can click the little hand icon, and that means you put up your hand, and then Amelia will see that you've put up your hand and ask you to ask your question, and we'll unmute you through the microphone there. Or you can type it into a question box, and that's the other way to do that, and Amelia will break in and ask the question for you or make the comment for you to our presenters when it's an appropriate time. So with that, I think that's about all as far as the housekeeping is concerned. I will let Amelia take it back from here.
Thanks very much, Drew. Well, it's a real pleasure for for us to welcome Saori, Pat, Lulu, and Sean to today's webinar. And over the course of the hour, you're going to get to know them a little bit better, and as well as the great work that they've been doing. But we're going to start off today with Saori and Pat. Saori Yamamoto from Keene has been the coordinator for the Vancouver Coastal Health's Community Engagement Advisory Network, Keene, since the summer of 2014. Her main role is to support members of Keene who are bringing the patient and family voice into planning at Vancouver Coastal Health, and also to support staff to work with Keene members. Saori is inspired every day by Keenes, who give their time and knowledge to help improve the quality of healthcare at Vancouver Coastal Health. Saori has a bachelor's degree in communications from Simon Fraser University and has been working in healthcare for 12 years. She is also the proud mom of 2 little ones. So welcome, Saori. And joining Saori is Pat. Pat Porterfield is a member of Keene, and she has been involved in palliative care as a clinician, educator, and researcher for the past 36 years. She retired from her position as regional leader for palliative care at the Vancouver Coastal Health in 2012, and while at VCH, she was involved in the regional development of advanced care planning. Since retirement, she has become involved with VCH's Keene, providing public education for advanced care planning. Pat also co-chairs the BC Centre for Palliative Care, ACP Public Awareness and Education Working Group. Saori and Pat, welcome to today's learning webinar, and we're looking forward to hearing more about your award-winning project. Over to you, please.
Thanks so much. We're so excited to be here. So Pat and I are going to flip back and forth, so if you notice a voice change, that's why. There's 2 of us here. Amelia, I'm just checking, everybody okay with what's on screen?
We can see everything and we can hear you just fine, so it's all yours.
Excellent. So first I'm just going to give a little bit of background about Vancouver Coastal Health. We are a large organization that provides health care to about 1/4 of British Columbia's population in both rural and urban areas. And as Amelia mentioned before, I am a coordinator for a network called KEEN. So Vancouver Coastal Health is very lucky to have a network of about 235 public volunteers who help to bring in the patient voice, the patient and family member voice into planning and service delivery here. That's just a little bit of background. Now over to Pat to take over some advanced care planning. Oops, there it is.
Okay. So we thought we should give a little definition of what advanced care planning is about in case some of you hadn't heard about it. So advanced care planning is a process where a capable adult thinks and talks about what is important to them in relation to their health care wishes in advance of a situation when they may be unable to make their own decisions. And it's interesting, as we are talking to people about advanced care planning, and even though it is future oriented, it is actually helpful for people in terms of their current decisions or in situations in the future when they are capable. So the focus is on incapability and future, but as I say, there's lots of benefits to engaging in advanced care planning. So before we go any further, we have a poll question for you. And Drew?
So thanks very much, Pat and Saori. So we have the poll question up in front of us now. Have you thought about who would make decisions for you if needed? And so we're just going to get our participants on the line to respond to that question. And we're going to shut that question down in about 5 seconds. All right, Drew, let's take it down and see what people have had to say. So Drew, I'm going to need your help at the moment because my screen is covering the responses. So can you please...
Okay, we're
Drew?
interested here.
Yeah.
Okay, so right now, a lot of people have thought about this. 92% say yes, they have thought about who would make decisions for you if needed, and 8% say no, they haven't.
Okay, so what's interesting is we've done these polls in BC, and so we can compare with sort of the average public in BC. And in BC, that same question, adults responded 79%. So what's interesting is people are thinking about this. They may not necessarily have done anything with it or talked to people about it, but they are thinking about it. Okay, so we're going to go on.
Thank you.
So the beginnings of our program, it
Muted.
began in the sort of, well, around 2006. And I was at that time part of a group that was working on a strategy for palliative care within Vancouver Coastal. And we had a group of KEEN members who helped us to develop priorities. And one of those priorities that they identified was advanced care planning. And to be honest, the public really gave us, these KEEN members really gave us the encouragement and support to continue looking at how could we develop advanced care planning within VCH. And a pivotal event happened in March 2010 when the members of VCH board, the senior leadership team, and the public, KEEN members, came together for a day and talked about advanced care planning. We presented them with information about it, but we also got their feedback about, you know, how should we proceed as an organization? What policies did we need? And if we were talking to the public, what should this look like? So that was really, really helpful to us. And the idea of doing this public engagement, sort of the public talking to the public, came out of that event. So next slide. So really, two major themes that came that day, as I mentioned already, was this idea of the public for the public, and the importance of conversation. Because with advanced care planning, there's thinking, there's talking. There are also some legal forms that people can complete and whatnot, and you can get kind of wrapped up in some of these legal forms when you do education about advanced care planning, and really miss the importance of communication, both with your families, your friends, and with healthcare professionals. So we knew that we really wanted to stress the communication, conversation elements of it when we do our public education. And why it was important to do public for the public, by the public, was some of the people at the forum were saying, you know, people are going to be suspicious of the health authority. wanting to promote advanced care planning, they're going to wonder if there's kind of an ulterior motive in terms of healthcare costs. So that was one motivating factor. And the other was that, you know, it's really important to hear from real people who have talked to their families and are willing to share those conversations. So, you know, we stress communication, but we share a lot of examples about communication, either from our own lives or from the stories that we hear from people that come to our workshops. So moving along.
So Drew, if you could put up poll question number 2, which would actually be number 3 that I sent you last night. Sorry, we're gonna cut it down to 3 poll questions.
The one about
Excellent.
talking with their family.
Yeah.
We've got it up now. So have you talked with your family about your healthcare wishes in the event you could no longer speak for yourself? So again, just reaching out to our participants to get them to respond. And let's close it down, Drew, and let's see what people have said. So 55% have talked to their family and 45% have not. So about 50.
This is really interesting because we, again, have statistics from BC, and I must say this group, although certainly the thinking about was quite a bit higher, the amount talking to their family is not that different. When we did the polls in BC, 49% of people had talked with their family. And so I think the group listening is very typical in that most of us are thinking, but we talk about this less. And so that's one of the reasons why we stress the communication when we do the public education. So moving on. So how do we prepare volunteers to do this? The most important thing we have found is that people are really passionate about the importance of advanced care planning. And even though I do have a professional background, I'm a nurse and I have a lot of knowledge about advanced care planning. Not all of our volunteers are in the same sort of background as I have. Some of them aren't healthcare professionals, or if they are, one lady worked in the lab. So, you know, it's a different group. We know that, you know, some people are teachers and whatnot. So the most important thing is this passion for advanced care planning. And then what we do is provide education about advanced care planning so that people do know the legislation in BC and feel grounded enough to facilitate the group. We also, though, really do emphasize that they are there to facilitate discussion about advanced care planning. So we present information, but we really encourage dialogue amongst the people that are present at the sessions.
So Pat and Saori, I'm just going to interrupt for just a second. I mean, when you think about the core values on you know, engaging people in meaningful conversations, encouraging people to become involved in a way that's going to be relevant to them, providing them with the important information and things like that. It's really interesting to see what you've done with doing this very much through the volunteers and making sure that it's people reflecting other people's values. So can you just help us understand a little bit more how this got developed and why people would volunteer for this?
Wow. So, I mean, why people would volunteer? A lot of times it has to do with a story in their own lives. A situation where someone had done advanced care planning and it was immensely helpful to them as a family, or a situation where it hadn't happened and they wish desperately that it had. So the motivation is often quite personal. Now, what other aspects of that question did you want me to respond to? So.
I think what's quite interesting to some of the people on the call is the use of volunteers. We often bring staff along or we hire consultants, but you've very much chosen to bring volunteers into this process and you've provided the capacity building for them so that they could do it. And I think what I'm hearing from you is it's working really well. And both from the participants' perspective and the volunteers' perspective.
Yeah. I mean, we recruited these volunteers from Keene too, so you have to already understand there was a pre-established culture of this. Yeah. These ladies have been longtime Keene members, a lot of them. So they were, often team members are looking for the thing that speaks to them, that is most meaningful to them. And like Pat said, a lot of them had been through it personally, so they were the perfect people to sort of do that. So yeah, it has been very successful, I think. So much engagement happening on many, many different levels that has really made a program that is working for people and working for the facilitators and also for VCH, for Vancouver Coastal Health.
So a couple of other things I can say to help answer that question. One is that some of these people also had a background in hospice, so that was another kind of layer of commitment to helping people do planning that would lead to them having, in the case that they were dying, a good dying experience. And the other element of it was why we were committed to public education was this concept that came up at the forum that it was good if the health authority was kind of one step back. I mean, we wanted to make sure that the people coming to these workshops know that the health authority supports this. Our materials have the health authority logo on it so that people know these aren't just someone that, decided to come tonight and give you a talk. So that it, had some sense that there was, an authentic process that they had gone through in order to facilitate these, but that these people weren't doing it as agents of the health authority, that they were doing it because they believe that, as good citizens, they want to get the message out to their fellow citizens, that this is something that we can all do to, have a good future for ourselves in terms of our health care when we will likely eventually have a time when we can't make decisions. Not everyone has that, but the majority of people do have that period of time in their dying process.
Yeah. And our facility in Vancouver always says, it's really a gift to your family. Like it's a gift. Think about how much easier it would be for your loved one if they knew what your wishes were.
So does that kind of convey what you were hoping that we could get across?
I think so. I think the important thing is that not everyone will be having discussions about death and dying, but they will have other conversations that are very personal conversations. And I think the fact that you've chosen to bring in volunteers is something that's a good takeaway for others that are on the call, that they should explore that possibility about who is the voice and who is the champion for the messaging that you're trying to get across. So thank you for that. Yes, thank you.
Okay.
Okay, so here's a quick snapshot of our program as it exists today. We've been running workshops for about 6 years, and currently we have 6 facilitators. There's 2 in Richmond, 1 in Vancouver, and then 2 in what we call the coastal area. So one who is doing workshops in a bit of a more of a remote area, and then 1 in North Vancouver, which is a bit more urban. And they each do about 4, I would say almost 10 workshops per year, because what inevitably happens is our workshops lead to more workshops, because people in workshops inevitably are like, can you come to my church group or to my community group and do this workshop? So it's growing in that way. And one thing to really stress is that this is pretty much like this program operates with very little drain on resources. I mean, basically myself I offer the administrative support, I promote the workshops, I take in the registrations, but the ladies do everything else, and they do it completely on a volunteer basis. So it's really, for Vancouver Coastal Health, also a gift for us that we can run a program like this. So as we mentioned, engagement and collaboration with the facilitators and with other stakeholders and community partners is really essential to keep this program going. Pat mentioned each volunteer develops a really personalized workshop, drawing from their own personal experiences to engage the workshop participants and really encourage that conversational way of speaking and trust, because it is a really difficult conversation to have sometimes, and we need to build that trust. From the moment that people walk into the room, the way that the room is set up, often like seating in a circular sort of format, really everything has been thought about so that we can encourage that trust and help keep that conversation flowing. We also have a 2-page handout that we provide for workshop attendees, and that is continually reviewed and revised with the support from the team. So really, I send everything out to them, and they support me to help support the program. And the group also supports each other really well as a team. They often reach out to each other with any issues that are going on or when help is needed. They often will co-facilitate with each other. So it's a really lovely group of people. And also we evaluate. So each workshop concludes with an evaluation because the ladies want to know, if their workshop is working, if it's providing what the public needs. And so we do an evaluation at the end of each workshop, and we look at those evaluations and review them, and usually they're all really good, but if once in a while there's something we need to look at and change. And we've kind of had to adapt as we've grown, because initially people were just coming to us with requests, and that was administratively getting really hard for myself. So we've actually created a little more stability by putting more regular workshops in the spring and the fall at specific sites, so Vancouver Coastal Health sites in each of the communities, and that's really helped provide some stability for the team. Over to Pat.
Mm-hmm. So we have continued to evaluate the program since it's developed, and certainly what gave a boost to the program but also necessitated a content review was that we had new provincial legislation in 2011 about advanced care planning. And in fact, now we have some standard materials that we use as well that were created by the Ministry of Health in BC. We've recently, this past year, been involved with the BC Centre for Palliative Care, who has also started to support volunteer-facilitated public education in other sites, and we were one of the programs that contributed to the development of these public education sessions, using the same philosophy as what we are doing in Keene, in that it really does focus on communication and wanting people to engage during these sessions, not to have didactic sessions about legislation, but to really have sessions that do involve people in these discussions. So that's been really reaffirming for us to be involved with the center. And then it's also been wonderful to have these awards. So we won an award at Vancouver Coastal Health. It was the first volunteer program award that they ever gave. The Keene people put forward the program as one of the programs to get a People First award, and there was no category for volunteer programs, and so they created one, and we were the first, so that was exciting. And then just more recently winning the IAP2 Core Values Award was again really affirming for us, so that's been wonderful.
So now we're going to go to our last poll question, please, Drew.
All righty. So we've got, has anyone heard of health programs that have a peer-led approach where they come from? If yes, what kind of health program? So if you've responded yes, please type your response in the question box and I'll be able to bring it forward to Saori and Pat. And if no, just let us know. So I think everyone's had an opportunity to respond, Drew, so let's close this up and see the answers. Oh dear. So
no one else?
The answer is 8% yes and 92% no. So it looks as though there's lots of opportunity out there, because I know we've got people with us from right across the US as well as Canada and in New Zealand and Australia. So hopefully some people are going to be getting hold of you, Saori, to see what we can do for setting them up.
Sure, give us a call. We have our at the end. Okay,
so we did have one person that is doing that, and that's the Canadian Cancer Society does a lot of peer-led support programming.
So yes. How amazing.
Yeah.
Yeah.
So Kira, thank you for that. That's great. So back over to you for maybe just another couple of minutes.
Yes, we're wrapping up, so thank you for that. So I just wanted to sort of wrap up with some quotes that we got from the evaluations that we've done with workshop participants. And I think that, what it really shows, what both these quotes really show, is that people walk away from these workshops saying, I can do this. I can do this. I can do this for myself. I can do this for my family. And I think that's the really key important part of a peer approach, because you do walk out of there feeling like it's not so far away from you. So yeah, so that basically wraps up our portion. I wanted to mention that please do view our video on the IAP2 Canada web page, but we also have a website or a web page up on advanced care planning, or please get in touch with me. We're happy to share any resources that we've developed for here. Most of it's on that website, but if there's any sort of questions or people want to talk through, we're happy to help support that.
Well, thank you very much to Saori and Pat, and congratulations on being Core Value Award winners. And now so I'm going to open it up to any questions. If you've got any questions at all, please don't hesitate to either raise your hand or put something in the question box. And I'm not seeing anything at the moment, but if you've got questions a little bit later, don't hesitate to ask, and we'll certainly bring it back to Saori and Pat's attention. But for now, we're going to move on to Lulu and Sean. And Lulu Feliciano is with the San Francisco Municipal Transportation Authority, right, Lulu? Did I just say that right? Agency, sorry, I'm sorry about that. Anyway, Lulu is the outreach manager responsible for managing staff supporting project delivery on the Van Ness Bus Improvement Project, the Geary Bus Rapid Transit, and Geneva Harney Bus Rapid Transit, as well as other capital programs and construction projects that support and rehabilitate our infrastructure for an expanding and reliable transit system. Since joining the SFMTA in 2008, she has developed and led numerous outreach projects, including extensive outreach during planning and environmental phase of Transit Effectiveness Project, now called Muni Forward, which implemented major Muni service changes in 2009 and 2010. Outreach for the LRV4 light rail design phase for SFMTA's new rail fleet, all-door boarding, and free Muni for seniors and persons with disabilities, to name a few. Prior to joining the SFMTA, she was at the San Francisco Chronicle and Examiner, overseeing advertising for the motion picture industry. Wow, that's quite the change, Lulu. Lulu and her husband love to travel, and when she can, make sure to check out the transit system anywhere she goes. So a good transit geek. Excellent, Lulu. And joining Lulu is Sean Cronin with the SFMTA. Sean is a public relations assistant at the San Francisco Municipal Transportation Agency. And since joining the agency about a year and a half ago, Sean has worked closely on the public outreach and communications for the Van Ness Improvement Project, which you're going to be hearing about today. Before joining the SFMTA, Sean worked in academic publishing. There he worked closely with authors, instructors, and students to develop tools for the classroom that encouraged higher learning through skill development and new technologies. When he isn't discussing priorities and needs with San Francisco neighbors during construction, he's searching for an authentic New York pizza experience in California. Well, Lulu and Sean, it's a real pleasure to welcome you to today's learning webinar, and we're looking forward to learning more about your Core Value Award-winning project. So over to you.
Great, thank you. Thank you, Amelia, for the really nice introduction. As Amelia said, our agency is quite large. We are a city and county of San Francisco agency, and our agency is responsible for keeping San Francisco moving.
So, Lulu, I'm just going to jump in for a second because we need you to take the screen so that we can see your PowerPoint.
I thought I did. Should be on your side. You're not seeing it?
I'm not seeing it at the moment.
Uh-oh, what's going on?
So, Drew, maybe you could take back the screen for a second and then resend it to Lulu so we can get that up. There, okay, just a second. Okay, Lulu, you should be able to grab the screen now. There we go. There we go. We've got it. Excellent. Thank you. Sorry to interrupt. I just wanted to make sure we can see your screen. Okay. Cheers.
So as Amelia said, as outreach manager for the agency, it's a quite a complex position for a complex agency. Sorry, I'm losing my voice. The agency is responsible for keeping San Francisco moving. For those of you not familiar, the city is not very large. It's only 7 by 7. So whether you're walking, biking, taking transit, or driving, we're in charge of getting you where you need to go. So today I'll talk about one of San Francisco's largest construction projects and how we use new techniques to cultivate relationships in the community and keep people informed and engaged with this project. The Van Ness Improvement Project is aimed at improving conditions for people who live, work, or travel on the corridor, which is shown in yellow here. The street is part of US Route 101 and is one of San Francisco's most north-south arterials. As a stretch of the urban highway, it connects San Francisco to Marin County in the north and San Mateo in the south. It's also one of the city's most dense transit corridors, serving one of the city's major employment and commercial centers that runs through several destinations like City Hall, cultural organizations like the Symphony, Ballet, and opera. The one thing I also wanted to call out, this corridor is it has a lot of rich history. During the earthquake in 1906, the firemen actually used it as a fire break to save the rest of the city. So if you're looking at the map, the eastern side was all burning up, and they had to use Van Ness as a fire break to save the western side of the city. There's a lot of rich history here. Construction on this project began last fall and will place a significant burden on the community because we're actually doing a major overhaul in the city. What we do with projects in the city now is if our agency has a transit improvement to do, what we do is we call on our other city partners like the utilities agency or public works, and what we call ourselves like the Three Sisters because we collaborate in a lot of projects. However, what that does is it's more efficient for project delivery, but conversely, the trade-off is it's actually more painful to the residents because now you're doing more work than what was originally planned. And so Van Ness is going to undergo a major overhaul, sidewalk to sidewalk, from 15 feet below ground to 30 feet above. And that includes all the utilities in the roadway. So we're replacing emergency water, sewer systems, street lights, lots of landscaping. So it's a big effort. And the reason why we're doing this now is we see Van Ness as a major corridor as the city sees rapid growth and change. To highlight that change, as you can see on this map, these are all the other projects that we're coordinating with. These are all private development projects. For those of you who have not heard, San Francisco is going through a major housing crisis. And these are 23 planned development projects, all dedicated to housing. So we need to coordinate with these folks. And that means the whole landscape of this corridor is going to change. So not only are we dealing with a corridor with a lot of rich history, but we're also dealing with a corridor that's undergoing major physical, demographic, and social change. And so what this told us is our current means of the usual posters and mailers and maybe just email was effective, but we had to find new ways to engage the public. So Drew, let's put up our poll. And the question is,
so what has been your agency's approach to P2 in the past? Has it been mostly traditional methods like town halls and mailers, mostly passive, interacting through posted notices? Hey, we use a consultant to manage an outreach in P2, and we're active, always trying new ways to reach new audiences. So let's hear from our participants on the line, which ones they use, because we're asking for the main one that you're doing. All right, Drew, let's close it down and let's see the response. So Lulu, it's mostly traditional methods at 64%. A consultant is 18%, and we're active as 18%. So a little bit of everything.
Yeah.
Although no one's just passive. 0 on the passive. So everyone's doing something.
That's great. Thank you, everybody. So as I mentioned before, we knew we needed something more diverse and really interactive to engage with the community. So it was a conscious effort, I should say, that we designed our P2 to meet the public needs. And at the foundation of our efforts really was and still is a belief that those who are affected should be involved in the decision. So in making this as a priority, we've been able to achieve several firsts for the city and for the agency. And what I'd like to do now is turn it over to my colleague, Sean, who'll talk a little bit more about the details and the specific tools that we've been using in the project. Sean?
Yeah, thanks, Lou. So Similar to you guys, we had been using a lot of traditional outreach methods, and as Lulu mentioned, it was effective in sort of building out a foundation for our outreach plans, but we really needed to figure out try out some new techniques and really get new audiences involved in this project. So one of the first things that we did was a pre-construction survey, and so what that involved was developing this survey that was available online as well as in print, and we sent it out to our email subscribers as well as mailing it out to the neighbors, and then we had ambassadors doing door-to-door surveys on the street. And that really got at the community needs and priorities during construction. So it asked questions about impacts such as noise, parking, things like that, to see sort of what the community's perception of construction impacts were going to be. And so we really sought out the involvement of those who were going to be affected by the project. And also it allowed us to sort of begin cultivating those relationships by directly consulting with the neighbors. And then it also allowed us to, we shared the data from the survey directly with our contractor. So we included the promise that their contribution would influence the decision. So we sharing the community's priorities and needs with the contractor really allowed us to develop a construction sequence that was in line with the community's needs. So it resulted in a little bit longer of a construction duration, but it addressed the needs that we saw in the survey about parking and traffic circulation. And from that survey, we also saw there was very specific business needs that popped up in the responses. And so it really did inform our construction phase outreach efforts. So from that, we formed our Van Ness Business Advisory Committee, which really promotes sustainable decisions by recognizing and communicating the needs of the businesses on Van Ness Avenue. So allowing us to collaborate with the businesses directly to develop any necessary plans and programs to address the needs and priorities that popped up on that survey, as well as that we knew were going to pop up throughout construction. So the committee really served as an incubator for formulating marketing and outreach campaigns. So right now they're helping us to develop something that they call the Construction Survival Guide. So they're really the experts on what the businesses need and what the impacts of construction are and what they're going to be. So we're really letting them lead the charge and really seeking input from them to design how they want to participate in the project. It also allowed us to partner with the Mayor's Office of Economic and Workforce Development here in San Francisco. So leveraging the business committee, the Business Advisory Committee, with this program really allows us to provide assistance with events, promotional materials, business tools for social media, different trainings, and technical assistance. And then one of the other things that we did were these walking tours, which were really just getting the public out onto the street, seeing what the existing conditions were on Van Ness Avenue, how the project was developing improvements that really got to the root of the issue and how people were experiencing the street today. And it was really an engaging and interactive way to sort of seek input from the community and to further develop programs based on the feedback that we heard there. And by providing a series of walking tours at different locations, it really allowed the public the opportunity to choose how they were going to engage with the project. And Drew, if you can just bring up the next polling question. One of the other techniques we used was text messaging. And so I'm curious to see what you guys think about the percentage of Americans who use text messaging at least once a day.
Thanks so much, Sean. So the question is up on the screen now. And so some fairly high numbers, 98, 97, 90, 80, or 67. So for those of you out in the audience, what do you think? All right, we just lost the polling question. Oh, there we go. So 17% think 98%, 8% think 97, 33 at 90, 8 at 80%, and 33 at 67%. So Sean, tell us, what is the answer?
So the correct answer is 97% use texting at least once a day. But all of the other numbers in this question pertain to another stat that's pretty significant about text messaging. So for example, 80% of American adults text, which makes it the most common activity on cell phones, and 67% find themselves checking their phone for messages even when they don't notice the phone ringing or vibrating. And 90% of all texts are read within 3 minutes. And then lastly, that 98% number, that's the average open rate of a text message, whereas email is only 22%. So it's pretty significant. As Lulu mentioned before, the audience impacted by the project is pretty broad and diverse. It's an urban highway that runs through 4 supervisor districts, 7 distinct neighborhoods. We knew that the demographics that our traditional outreach methods had reached. We knew that we needed to do more to lift up the voices we weren't hearing, because we kept hearing from the same voices that we've heard from on other projects, and we really knew that we needed to do more. We also knew that we needed to find a way to keep people engaged throughout the entire 3 years of construction, so interactivity was a priority for us. We were interested in trying out a text message campaign after we heard about how it was used in Chicago. We knew from their use that text messaging could really provide an additional channel to reach out to people, consult with them about project decisions, and it really did help in engaging younger audiences. So we started working with GovDelivery, which is a service our agency uses for our email campaigns, to develop a strategy for our text messaging campaign. When we first started working on this, we were a little bit skeptical about how effective the text messaging would be for our work. So a lot of the examples that we had looked at were really using text message surveys to make a very specific decision, like the location of a bus stop or a bike share station. And our project was really getting close to entering the construction phase. So these sort of sexy decisions had already been made. And so our goals were really to reach new audiences and get them to sign up for project updates and invitations to events, so that they knew when decision spaces would open up and when they would be able to make their voices heard and voice their opinion on these decisions. So our first campaign, as you can see here on these slides, we posted these different posters up at bus stops along the corridor, and really the messaging behind them was really geared towards highlighting the improvements that are included in the project. And so any text message to the number on the posters launched an interactive survey that really got to collecting demographic data, as well as an option to sign up for text message or email updates. And we saw a pretty significant response rate pretty quickly. So we wanted to build on that as quickly as we could. So we started developing these in-language text message surveys. As you can see here, we posted these not only on the bus stops, but we expanded it into the vehicles themselves. And so a text message to these numbers launched an in-language survey. So if you were responding to a Chinese sign that you had seen, you got a survey that was in Chinese. So we were able to engage and cultivate a broad audience pretty quickly. And within the first 3.5 months, we grew our total subscribers for about 12%. And to date, we've just from this campaign alone, we've gotten almost 1,000 responses to date. So it's been pretty quick, pretty significant. So 60% have indicated that they're unfamiliar with the project. So we know that we're meeting that goal of reaching new voices that we weren't hitting with our traditional efforts before. And 79% have opted in for text message and email updates through the survey. So we're really, that's really getting at the second goal of this campaign in keeping people engaged and getting them informed. And lastly, 41% indicated that they're under 34. And so we're also seeing that we're reaching younger audiences. We're even drawing them to our other engagement activities. We have a monthly speaker series, and we're starting to see high school students show up to these. So we're really getting at that younger audience that we were looking for. And the campaign was actually so successful that other projects within the agency have started to use it as well. So I just wanted to go over briefly some of the lessons learned. The biggest lesson that we learned about the text messaging campaign was our second question was are you familiar with the Ness Improvement Project? And unfortunately, the functionality of the platform that we were using didn't allow us to provide project information for people who responded no. Everyone is given the same survey, regardless of their response to that question. So we learned pretty quickly that it's really important to cultivate these contacts. It's important to keep them engaged really quickly after they submit their survey response. So sending that project information pretty soon after the survey closes out. And on the slide here on the right, these are some resources that we used in developing this campaign. You'll see that a lot of them are specific to the platform that we use, TextIsIn, which is under the Gov Delivery umbrella. But there's a lot of really great information in each of these, regardless of the platform that you use. And if you're interested in pursuing text messaging for your project, I would encourage you to look at each of these and really there's also examples and everything on there that can really help you think through some sort of solutions, and there's a lot of lessons learned on there as well. If you're interested in learning more about the project, or if you have questions, the project website is sfmta.com/VanNess, and on there you can see we put together some online videos that are hosted on YouTube as well as on our project website. We've incorporated the text message survey into those videos as a call to action to sort of make them a little bit more interactive as much as we could, and really folding things in as much as possible into our other outreach materials. So if there are any questions, I'd be happy to answer them.
Thanks, Sean. Well, there was some questions, so let me just get to them. Just open this up a little bit. Rhonda was wondering whether you can direct us to the source for the data of the percentages of residents who use texting. Just wondering where you got those numbers from.
Are you talking about the numbers from our survey or the numbers from the polling question?
Yeah, the polling question numbers, then sort of the 97, 96 ones.
Yeah, the 97% number I got from, I forget what the agency was that did the study, but basically if you Google text messaging marketing, then all these stats should pop up.
Great. And if you can remember, we can send it out as a link as well, Sean, when we send out the other materials. Yeah. Because just a reminder to everyone, we do provide you with the PowerPoints so that you can certainly have the opportunity to see those and get more information from that. So I'm really encouraging other people to send us more questions, but while other people are thinking about that, I've got a couple of questions. In both cases, for Sean, you and Lulu, and also for Saori and Pat, both of you made a very significant effort to do outreach to people that were going to be involved in asking them how they wanted to be engaged or involved in the processes that you were undertaking. Certainly for Saori and Pat with the various workshops, they asked right up front, what's going to work for you? How should we do it? Why should we be doing it? For yourselves, Sean and Lulu, it was like, how do you want to be engaged? How do you want to be involved? These are pivotal to the core values. And I'm just wondering, did you have a champion inside that said this was the right thing? Did you as a group think that this was the right thing to be doing? Is it very different from the way that you've done it before? And also, how are people responding to this new approach about really embracing them and saying, we want to do what you tell us, and how do you do it? So lots of questions in that, but it is a different approach, and seeing how many people still do it the traditional way, I want you to give people courage and hope that you can change things and that it's worthwhile, because I know both of you have evaluated as well. So I don't know who wants to kickstart in responding to that.
I'll take that, Amelia.
Okay, excellent.
We knew that this construction project was going to be difficult, and our agency is actually doing another construction project, which is actually even more difficult because it's for a tunnel for Central Subway. And watching all the construction going through the city, we as a team knew that the traditional methods are just not enough anymore. the virtue that all these complaints come up, people are unhappy, people are disgruntled, but we also wanted to be proactive. It's like I didn't want to sit back and wait for the complaints to come in. I wanted to go out there and say, and engage with the public. And so it was a very conscious effort to do that we made. It was also a conscious effort to dedicate a team to this project as opposed to outsourcing it. And we're now seeing the benefits of not only staff really engaging with the public, but even those, it's funny, even those who still oppose the project actually compliment the team all the time for their constant engagement. So I encourage everyone who's listening is, I know it's kind of scary in the beginning, but actually it does pay off. It really pays off when you go out there and try to engage with them. And even if they disagree with you, they will admit that they respect you for doing so.
Thanks, Lulu. Saori or Pat, any thoughts about the questions?
Well, I keep going back to that public forum that we had with Keene in March of 2010, and it was so interesting. The way the Keene membership said, you need to get out and do public education, and not done by healthcare professionals. And in fact, some of them that day, you asked about how we found people, some of them that day actually said, and we're happy to do this education. We think this is a good thing for us to be doing. So, and they also helped us shape what the education should look like in terms of the, emphasis on communication. So I would say, it was the public telling us this. They were Keene members, so obviously it's a certain subgroup of the public, but they were very committed to this approach, and I don't know if we would have done that if we hadn't had that forum with the membership and their advice about how to take advanced care planning forward and do public education.
Yeah. And I'll say, as the person who sort of provides administrative support, I also do it because I can't help but be infected by the passion that these ladies have and just the goodwill, about spreading this. And I feel like it's not hard to do. It's not hard to find people who want to go that extra mile and learn how to sort of, learn, not only the legislative stuff, but also how to facilitate. These ladies have really, grown. I think it's been professional development for a lot of them too. Maybe not for Pat, but for a lot of them. And so I think, you only need to ask. We have a culture of engagement. We have a culture of collaboration here, but every time we go out to our key members and ask them something, even if it seems like something really like a lot of work, we always get a good response. And I think it is just about building that relationship with this special group of people, and it really is a pleasure to work with them, and it's easy. They make it easy for me. So
thank you. So I'm certainly hearing a lot about building relationships, building trust, and the importance of going out and asking, which both of you did, to find out how people want to be engaged and involved. And I'm pleased to hear the results also, and glad to hear that you're evaluating. So I do have a very specific question from Maura, and this is to you, Sean. Do you have any estimates on the cost of doing the texting campaign? And also, just a quick question, do you think a texting campaign would be feasible in rural areas?
I don't remember off the top of my head the cost associated with it, but I can absolutely send that to you, Amelia, for distribution later. And in terms of whether or not it would be effective in a more rural area, I think so. I come from a very rural area on the East Coast, and I would say that the texting patterns are pretty similar in both circles that I've run in. And the data really does show that text messaging marketing is really effective. I know that I spoke mostly about how we're using it on a construction project, but there's a lot of information out there on like consumer behavior and text messaging marketing as a whole. And I think that really does speak to all areas, not just metropolitan cities. So I think it can be really effective. It's just a matter of really developing the materials yourself and like thinking through where are you going to put the signs, for example, for how you're going to prompt people to initiate that first text message. I mean, we're lucky in that we have the bus stops and the buses that are pretty heavily trafficked, and so they're very visible. So that might be probably the biggest challenge that I could see in doing texting in a rural area, but I think it can definitely be successful.
Thanks, Sean. And so just a quick question, and this is really to your internal people. So how do you think your decision makers and your internal colleagues, how do you think they're responding to these changes in the way that you're delivering P2? And that's kind of an open question to all of you as well. Do you think it's given them a comfort level that the public is more comfortable with you? I know you responded a little bit about that, Lulu, but I mean, it is a different approach. So from internally, good things, 2 thumbs up?
3 thumbs up from our director. Put it this way, construction is disruptive. We still get some concerns, of course, but at least we're able to manage those concerns and the public's expectations. So the organization is really pleased with the first and the experiments and the pilots we put out there with this project, so much so everyone's being held to the same standard now. So my colleagues are happy and unhappy with me at the same time because more is being demanded from them, but I think they're seeing results of really valuable work. So not to say there'll be cookie cutter for every project in the city, but at least for the ones that are most disruptive, the expectation is that we will provide the same level of engagement.
Thanks, Lou. Any thoughts from either Pat or Sean or Saori?
Yeah, I'll say, I mean, I think that internally there has been some really great response. We have a lot of staff that attend the workshops now too. They're like, is this for staff too? And we're like, yeah, you can come. And then I think, you know, just we won that People First Award, I think, last year, which is like an internal award. And I think that also helped to create this, you know, knowledge of it and the fact that we're sort of running this program a little bit more widely. So I think it's been really great. The response has always been pretty good. I think, you know, we've even had some questions like from staff about when is there going to be staff training, you know what I mean, to do this and stuff. And so that's like a different phase, and we're not ready to go there yet. But yeah, it's been really great so far.
Well, I want to express my sincere thanks on behalf of IAP2 Canada, IAP2 USA, and IAP2 Australasia, and all of our participants, and the people that we know will be watching this when the recording after, to Pat, to Saori, to Lulu, and to Sean. We really gratefully appreciate you taking your time today to share your projects with you and your wisdom with us, as we encourage everyone to try new and different approaches and new and different techniques. And Sean, it was great to hear from you that you've tried some things and you've learned some things, and it sounds to me as though you might do a few things differently with texting, but at least you took on the challenge of how do you engage people, and it was great to hear that you're engaging more youth with the text messaging as well. So thank you very, very much for that. I just want to remind everyone about what's coming up next month. We're presenting another Montreal Encore, which is one of the presentations from the 2016 IAP2 North American Conference last year, and it's Make it interesting. Sam Boreski and Jamie Harvey of JLA Public Involvement will share their ideas and experiences in how to make your engagement process more engaging. So we obviously are thrilled to be able to talk about our Core Value Award winners. We're also thrilled to be able to bring you some of the sessions that were really popular for Montreal. And of course, I need to remind all of you that our Core Value Awards application process is now open. And if you've got just a fabulous project that you think the world should know about, then we would encourage you to apply for the Core Value Awards. And of course, we've got our North American Conference coming up in Denver in September 6th to the 8th. And the schedule at a glance is now up there and available, so you can take a look at what's going to be offered in our conference in September, and of course you can now register as well. So I would like to thank everyone very much for joining us today. It's been a real pleasure to host you, and again a big thank you to our presenters. Any last word from our presenters before we go?
I just have one last comment. It's Pat, and we just wanted to remind everybody that April 16th is National Advanced Care Planning Day in Canada, and I believe in the U.S. as well. So there you go.
So we're encouraging everyone. That's great, Pat. Thank you. Thank you for that. And by the looks of things, you know, people need to be taking advantage of these workshops that you're running. So, so thank you very much, everyone. I hope that everyone has an absolutely fabulous day, and we look forward to welcoming you back to our learning webinar, second Tuesday of the month in May. So thank you so much, everyone. Have a great day.
Okay, thank you.
Thank you. Bye-bye.